And now to the southwest region of the country. The Lagos State Commissioner for Health, Professor Akin Abayomi, has called on all Lagos residents to support the government's efforts by adhering to hygiene practices. Professor Abayomi made this appeal at a press briefing on cholera outbreak in the state.
Cholera is a waterborne disease caused by bacteria that can be easily spread through contaminated hands or contact with someone who has been in contact with contaminated water or sweat containing pathogens. The Lagos State Commissioner for Health, Professor Akin Abayomi, has confirmed that the total number of suspected cases in the state is 579, with 29 deaths. Most of the cases involved patients who were brought into the health facility late. Professor Abayomi stated that the cholera strain affecting residents in the state is subtype O1, which is highly contagious and causes significant illness. He further reported that there are 209 cases in the general hospitals, 193 in primary health facilities, 152 in private hospitals, and 14 in the military, police, and other security agencies in the states.
We have some very severe cases that we were able to rescue. Very severe dehydration at the infectious disease hospital because their kidneys had shut down from the severe dehydration, and at that facility we have access to renal dialysis, so we're able to wake the kidneys back up with renal dialysis and rehydrate them. And those are the kinds of cases that we still have on admission because they were very, very severe and we're able to rescue them from dying. As I said, most of the patients that did die were either brought in dead or by the time they came in, they were so severely dehydrated we could not rescue them. Which is why we reiterate that once you develop symptoms, please do not stay at home. While you're at home, use oral rehydration therapy and present yourself to the nearest facility. Ideally, a public health facility because your treatment there will be free. But if you go to a private facility, they will first of all give you first aid treatment, and then you can request to be referred to a public health facility where your treatment will be free.
Officials of Lagos State government also aired their views on how they're helping to curb the spread of this disease.
All the cameramen, all the people that work for you, just continue to tell them, have you washed your hand? Have you washed your hand? All those food sellers on the side, which water, where did they get their water from? Don't just drink water anyhow. Yes, it's hot and you're thirsty. Watch what you ingest. Food, water, beverage, it really doesn't matter. Once it's contaminated and it gets into your mouth, you may get, and I said may get cholera. So thank you very much.
We also have a team that check regularly our toilet facilities. And we have also trained and enlightened our teachers on the necessary step to take if there is a need for a student being sick or whatever based on cholera.
You absolutely should raise an alarm, discuss with people around you. When you see them doing those things, report to us, report to the Ministry of Environment, all our SEPA, we're going to take it up. But I think that it is everyone's responsibility. It is a community-led sensitization program. You are going to take ownership of your own space, your own streets, your own environment, and raise alarm whenever you find something that is not properly done.
They called on the general public to engage in frequent hand washing and proper sanitation of our environments.